Did you know hearing loss is one of the most common birth defects around the world? 1 in every 1,000 babies is born with a permanent hearing loss. But there is good news. We've seen massive advances in hearing technologies, and babies can now be diagnosed with hearing loss very soon after birth with newborn hearing screening programs. But this isn't the full story. Just because you can hear doesn't mean that you're going to develop optimal speech and social skills. My research shows that mothers actually limit their speech when they're talking to babies with congenital and simulated hearing loss. Counterintuitively, mothers speak less clearly and place less emphasis on the different sounds compared to mothers with normal hearing babies. And this is a problem because research shows that despite early diagnosis and intervention, babies with hearing loss are still showing language delays. We also found that mothers' interactions with hearing-impaired babies are less positive and babies involve their mothers less. So what this means is that babies are missing out on language and they're missing out on important social and emotional signals. So why is this important? It's important because we now know that mothers need support to stop sacrificing beneficial language features and to encourage more responsive interactions. Mothers might actually be hindering their child's development. Peekaboo, baby, where are you? This is what myself and many parents around the world automatically do when we're talking to our babies. But we don't just do it because it sounds cute. We now know that it has 3 developmental functions. The exaggerated pitch engages and maintains our baby's attention. It conveys our emotions, and it facilitates language development by emphasizing the difference between sounds, like E and ooh. But my research is showing that babies with congenital and simulated hearing loss aren't getting all of these modifications. This research has garnered interest from various media outlets like the Sydney Morning Herald and the Northern Virginia Organisation. In response to coverage on ABC Science, a spokesperson for the Royal Institute of Deaf and Blind Children said, "This study has important implications for how mothers of hearing-impaired children are encouraged to talk to their children." So what does this mean for families with babies with a hearing loss? It means that we need to improve the quality of early interventions so that we can address these problems while their babies are pre-verbal and minimise the need for long-term health services and the costs. There are 2 ways that we can do this. Firstly, we need to provide more support in teaching parents and professionals how to speak clearly to babies and the benefits of this. Adults speak more clearly in noisy environments. It might be as simple as wearing noise-inducing earphones while they're playing to encourage more of this automatic behaviour. Secondly, we need to equip the whole family with skills to engage these babies in more responsive interactions. My work in the UK with video feedback therapies shows that after only 3 sessions, families with pre-verbal hearing-impaired children engage their babies in more responsive interactions, and the babies produce more vocalizations. So we should be including video feedback in our Australian intervention programs. Ultimately, this research has far-reaching consequences for the families and people that work with babies with hearing loss. My goal is to make sure that all babies can have the benefit of hearing their parents say, "Peekaboo, baby, where are you?" Thank you.